Good afternoon, everyone. I'm so happy to meet you again in this short lectures, really, because I need to share with you a very interesting and unique science I've watched in one of my patients recently, brain B-lines. All of you know about the lung B-lines, but really I saw a brain B-line in one of my patients. This is a young patient in 40 with hypertensive bleed. He developed massive left side basal ganglia bleed, and because of deteriorating conscious level and brain edema, he has got a left side decompression craniotomy. And after the operation, patient was admitted to our ICU. I saw the patient with brain ultrasound after operations. As all of you know, the bone is the enemy of ultrasound, and after removing of the bone by decompression craniotomy, it will be very easy and very clear to see the brain. I put here the probe of transcranial Doppler in the left temporal window where there is no bones at all. The brain is just below me. I find this unique picture of the brain. This is the frontal lobe, this is the occipital lobe, this is the phalanx cerebri, and this is the hematoma. Didn't be evacuated really. The patient has only decompression craniotomy, and this is the hematoma. It's very clear, and you can see this is the phalanx cerebri, and you can see even by visual assessment any midline shift. You can measure the hematoma every day to know about the progression of the case. You can measure the midline shift even from one side and follow up daily if there is deterioration. Yani this day it was 8.3 centimeter, and you can follow next day, and to see if there is any progression of this midline shift. And I did transcranial Doppler, but this from the right side. This is the butterfly midbrain, and this is the right middle cerebral artery. And really, after decompression craniotomy, the cerebral blood flow, middle cerebral artery flow improved a lot with very good diastolic flow, and the BI improved. It is now 1.14. The normal is 1.1. That means very slightly increased, denoting no resistance in the flow of the brain and very good flow. But really, during admission ICU with follow-up, I saw these B lines of the brain. This is the meninges, thickening meninges, and this is the B line of the brain. This is the soft tissue, subcutaneous tissue, and the no bone here. This is from left side. As we all of you know, the B line will appear if there is air beside interstitial edema. The air probably is present in the brain after operation, after removing of the bone. But this B line denoting interstitial edema of the brain. You see here, there is very clear B line. All the definition of B line is there. It is coming from the meninges here, and it extended to the end of the screen, and it's very clear B lines here. And here you see B line. That means there is interstitial, there is edema in the brain. There is water in the brain intermingling with an air which enters the brain after operations. The questions here, this unique science of brain B line, the questions here, can we use this brain B line as a clue for brain edema, which can be targeted and followed during treatment? After giving dehydrating measures, you will follow for disappearance of this brain B line, especially in patients who undergone craniotomy, because this will be very clear to see the B line because the air will enter the brain. And also could be happened in patients with aeroncephaly after trauma. I believe this is a unique science. I didn't remember anyone talk about brain B line, but we need more research for this brain B line, especially in patients after decompression craniotomy. Thank you a lot for watching. See you in another project. Bye-bye.